is Bryn Zolty and I'm a physical therapist with Connect Physical Therapy. I want to spend a few minutes going over kinesiotaping, specifically the crisscross method for diastasis or diastasis, DRA, however you prefer to pronounce it. Hopefully you've already watched Michelle De La Rosa's video, which you can find on our YouTube channel or website, giving you more background information. The purpose of this video is to explain the taping. So the tape is used by women who maybe feel a little bit unsure or unsteady of returning to exercise because they feel that gap or spreading between their six-pack muscles. The tape can help them give some confidence during their exercises because unfortunately the internet has told them that they should never exercise again and it's going to hurt them. Some women do experience pain in their back or in their hips. If the diastasis is contributing to that, maybe this will help. Ultimately, as physical therapists, we like to use the kinesiotape hopefully to help you activate the muscles in your abdomen so that you can exercise confidently, so that you do have a decrease in symptoms. But we're really looking to help you reach whatever your functional goals are, being running, CrossFit, exercise, or lifting a baby, lifting a carry, or pushing a stroller. Whatever you feel you need. There's not a high level of evidence saying that there's one perfect taping method or that tape really helps with the diastasis. There's not a lot of evidence that closing the gap is the best way to treat this, but certainly there is evidence that exercise will help you gain strength and be able to do what you want to do. So this tape might help you better activate the abdominal muscles. So that is what I'll show you today, is the crisscross method. I advise my patients, if you want to try it, see if it works for you. There's many methods. You can try the different methods, but ultimately if you don't like any of them or you have a reaction to the tape, still go ahead and feel confident in exercising. You don't need the tape to exercise. If you have uncertainty, please contact or make an appointment with a pelvic physical therapist or someone who specializes in treating women postpartum or people that have a diastasis, and they'll help guide you through exercises so you can have the confidence that what you're doing is helping you. So I have KT tape. So this is what I'm using today. If you've never used kinesiotape, I would suggest that you cut a small piece off and place it on the skin, leave it for a few hours or overnight. Make sure that you do not have a response to the adhesive before you go ahead and apply a lot of tape to the abdomen. I have pre-cut a few of these to fit the size that I would like them on my abdomen, and that might be something that you make adjustments with. And to go ahead and make more strips, I just line it up and cut along here. As you can see, I have rounded the edges of my tape, and I do that because traditionally if the edges are more square, they come off a little bit more easily. Okay, so we'll go ahead and start taping. Okay, so now I have my piece of kinesiotape that I'm going to start with, and like I said, I have the edges rounded, and you can just fold it over to begin to remove the tape off the backing. Okay, whenever you start or end a piece of the kinesiotape, you want to place it with no tension at all. If there's tension on it, it will come off more easily as well. So I'm going to start inside. Here's my ribs. I'm going to start right inside, right on the edge of where that six-pack muscle starts to come into more of the obliques or the outer muscles. So I'm going to start right here. You can vary this and you can place it over where you feel the greatest weakness, or you can do the entire midline. A lot of times, a lot of the weakness is closest to the belly button. So I'm going to go ahead and put on my first piece of tape. And like I said, I'm going to set that down, and I'm going to go ahead, give it a little bit of pressure, rub it, try to activate that glue. I'm going to set that nicely. For this tape, we want about 25% tension. So if you're unsure of what that is, you can slide your tape down a little bit. You can pull it as hard as it goes, anchoring this. That's 100% tension. So if you about half that, you're about 50. And if you half that, you're about 25.
So you have some tension, and you go ahead and you lay that across. Before I put my end piece on, I have again removed my tension because I want my end piece to just lay nicely down. I'm going to go ahead and activate that whole piece of tape just with a little bit of friction. Okay, and there's my first piece. I'm going to go ahead and place my second piece on. Again, just a little tear at the top will help you get the tape off. I have the top of my tape that's going to be my anchor. I'm going to come right inside the ribs, but on my six-pack muscles, not all the way out here on my obliques. And this is where I'm going to start, just opposite of where I started the last one. Okay. So again, I've got this on down with no tension on, and I give it a little bit of friction to help activate it. I'm going to go ahead and, if you need to, pull 100, let go half, let go half, and then go ahead and lay that down. Okay, keeping that 25 till you get to the end piece. That end piece is going to lay down with no friction now, or no tension. And I'm going to go ahead and rub that piece on nice and tight. Okay, and this is a great way to begin. All right, patients that I have worked with and are quite familiar with their deeper abdominal muscles, their transverse abdominis, their TA, I might go ahead and have them activated slightly when I get down to the lower section. And that's a great way to have a little extra tension on the tape without pulling on it. But again, be sure you know, if you're going to try that technique, how to go ahead and pull in the TA without turning on every muscle in your abdomen. So now my first piece went this way, my second piece went down from my left to right. Now this one's going to go right below it, the first piece that I placed. I'm going to go ahead and set my anchor. I'm going to slide back. I'm going to give it a lot of tension, half it, about half it. So now hopefully I'm closer to that 25. Okay, and then I'm going to lay down my end piece with no tension, and then I'm going to go ahead and rub that and hopefully set that glue. Okay, another piece. And you're going to keep repeating this again and again to however amount of your abdomen you want to cover, or you could do all the way down the midline. And then again, no tension. Okay. All right, so the last piece went this way. So now I'm going to come back to here. Put my third piece on for this side. Go ahead and set my anchor. No tension on the anchor. I'm going to pull half, then about half. Okay, and if you wanted to, you could pull in the TA just a little bit. And then the bottom with no tension. Okay, and I have this piece. Okay, so my last one went from here to here. So now I'm going to go and put my next one right here. I'm going to go ahead and set that down. Slide the backing off to about my anchor. A nice pull, half, and about half. I'm going to lay it on. And again, no tension at the end. Okay. I'm going to go one more piece on either side. Okay. So my last piece went from here down to here, so I'm going to come back over to this side. Still trying to hang out on those six-pack muscles. I'm going to anchor that down, slide my tape back, go ahead and get tension, and I'm going to half it and about half it, lay it down, and then there goes my anchor with no tension. Okay, last piece. Okay, so my piece that I just put on went right down to left, so I'm going to place my last one on this side. I'm going to place my anchor down, no tension. Slide my tape back, go ahead and give it a nice pull, and half it, and I'm going to go ahead and lay it down. And then my anchor, no tension at all. Okay, and that's how I would do the crisscross method for a DRA.